Hi, my name is Lindsay Keating, and today for this video, I'm going to be performing how to place an NG tube. So first, you take your NG tube out of the plastic bag, and I'm already wearing my goggles and my gloves, perform hand hygiene, and explain the procedure to the patient. So I'm going to start with my distal end, and I'm going to measure it from the nose to the ear, down to, nose to ear, down to the xiphoid process, and I feel it upon palpitation. And normally I would do this without the patient's clothing on, but today we're just going to note that we would do that without the patient's clothing. So I feel for the xiphoid process from the nose to the ear to the xiphoid process, and I feel it upon palpitation. And now I'm going to mark it with my dog earring tape, just so it'll be easy removal after insertion. So after placing the NG tube and marking it with dog earring tape, I'm going to take the ending of it and I'm going to apply tape to the nose or to the cheek. And to make sure I placed it correctly, I would take a tongue blade and my pen light and look at the back of my patient's throat to make sure I placed it correctly. Another way to notice if I've placed it correctly, I can take my 60 milliliter piston syringe and place it into this port right here. And I can aspirate for gastric contents to make sure that I placed my NG tube correctly. Another thing I can do is I can take the wall suction and place my wall suction in that same exact port at a low intermittent suctioning to see if any gastric contents comes up. And also, if I don't want to do either of those, I take my Salem pump, which is the blue pigtail, and I can cap it off in that same exact port, and I want to make sure that this blue Salem pump pigtail blue Salem pump is always above my patient's stomach.